Okie dokie. Now we'll finish off chapter 9. Long, I know, but cardiovascular system is no joke, and you have to really study this so that you don't hurt anyone while you're working with them in physical therapy. So the last one is diseases affecting the blood vessels, aneurysms, PVDs, and cardiac cancers. So an aortic aneurysm is a dilation of the aortic lumen. Tendency to increase in size and rupture regardless of location. They could be chest cavity, thoracic aneurysm, brain, cerebral aneurysm. Most common cause is atherosclerosis. What are the signs and symptoms of someone with aortic aneurysm? Typically produce no symptoms until rupture occurs. Mortality rate of abdominal aortic aneurysms is 90%. 65 to 75% of patients die before their arrival at the hospital, and up to 90% die before they reach the operating room, diagnosed on MRI, CTs, or ultrasound. So an aortic aneurysm, there's an aortic aneurysm right here. How do you treat it? Surgical repair to prevent the rupture. Disease areas removed and replaced with the artificial graft or segment of another blood vessel. Now PAD is peripheral artery disease. Diseases affecting the peripheral arteries are similar to those affecting the coronary and carotid arteries. Produce ischemia, a lack of blood and oxygen supply, pain-impaired function, infarction, and tissue necrosis. Atherosclerosis is an important cause of PAD. Most commonly affected arteries are the femoral, leg, and the popliteal. So femoral meaning femur, popliteal behind the knee. So PAD, peripheral artery disease, signs and symptoms, intermittent claudication, pain with walking, thinning of the skin and subcutaneous tissues of the lower leg. Foot feels cool to touch. Lower leg pulse may be faint or absent. Ischemic pain at rest, ulceration, and or gangrene may result if chronic. Peripheral artery disease, treatment aimed at prevention of further complications and affective tissues. Walking slowly to increase circulation, avoiding injury as wounds heal slowly, blood thinning agents to prevent additional clotting, surgical bypass around clots may be indicated in severe cases. So here are some ankle brachial index, and I'll show you this video in class. Patients should be in supine position for accuracy and consistency. So if we look at this, I'll move this down here. If their ABI, which is their ankle brachial index, is greater than 1.4, they could have a calcification or vessel hardening, and we would need to refer to the vascular specialist. If their ABI value is 1 to 1.4, that's normal. 0.9 to 1, acceptable, nothing to be done. If it's less than 5, severe arterial disease, refer to vascular specialists. 0.5 to 0.8, moderate arterial disease, refer to vascular specialist. Okay, so these are some things that we want to look at, and again, I'll play this video in class so that you can see how to monitor the ankle brachial index. Now going back here, let's go, put me right here. Alright, so Raynaud's disease, more common in females than males. Functional disorder of the arteries caused by vasospasms or intense spasms of the arteries and arterioles in the fingers and toes. Usually occurs in healthy young women. Precipitated by exposure to cold or emotional stress. Raynaud's disease, signs and symptoms, changes in skin color from pallor to cyanosis accompanied by sensation of cold, numbness, or tingling. Color changes most notable in the tips of the fingers, later moving to the more distant part of the fingers and hands. Treatment aimed at reducing triggers and protect hands from trauma, like wear some gloves, medications to reduce vasospasm. So that's what you would do with someone. It's not life-threatening, but just something to keep an eye on. Cardiovascular system, venous circulation of the legs. Now we did arterial, now this is venous. So let me see if I can put myself here again, or there we go, that's out of the way. Consists of superficial saphenous veins and deep venous channels. Blood from skin and subcutaneous tissue accumulates in the superficial veins before being transferred into the deeper channels for return to the heart. Venous valves are located in the veins, preventing backflow. Leg muscles also assist in moving venous blood flow from the lower extremities to the heart. There's varicose veins. You've heard of varicose veins. Dilated, distorted veins that usually develop in the superficial veins of the leg. Veins become swollen and painful and appear knotty under the skin, caused by blood pooling within the veins because of decreased stagnated blood flow. Very common in nurses that do 12, 16-hour shifts, so they wear these compression hoses to help with circulation. Some of this is hereditary, so if your mom has varicose veins, unfortunately you might have a high susceptibility of that as well. Can be occupational hazard related to a long period of sitting or standing. Normally, leg muscle movement moves blood up within the vein from one valve to the next. Without this milking action of the muscles, the blood exerts pressure on the closed valves and thin walls of the veins. Veins dilate to the extent that the valves are no longer competent, and blood collects and becomes stagnant. Veins become more swollen and painful. So keep an eye on that, and sometimes if you work the hospital shift, you might have to do 12, 14 hours. Sit there when you get a chance on your break and pump your ankle, and try to lie down, maybe supine, and pump your ankles above your heart. Okay. Varicose veins, pregnancy or a tumor in the uterus can also cause varicose veins because pressure on veins causes resistance to blood flow. Hereditary and obesity also are associated with this. Complications of varicose veins, you can get ulcers, infection, and hemorrhage. How do you treat varicose veins? Well, depends on the severity. Elastic bandage, compression hoses, walking, elevating legs when seated, losing weight. Surgery, TURMED, surgical vein stripping involves removing the veins and tying off the remaining ends. Collateral circulation tends to develop to compensate. There's some laser techniques that plastic surgery offices say they can do now, so just depends. Spider veins are different than varicose veins. Spider veins are small, dense networks of veins that appear as red or bluish discolorations of the skin. This is where the laser treatment, which heats and scars the tiny superficial veins, which closes them off the blood supply. You can also do compression sclerotherapy. It involves a strong saline solution being injected into the specific site of the varicose veins, which irritates the vein, causing scarring of the inner lining and fusing the vein shut. So, a little dramatic, but something that you can also do if you don't like those spider veins. Alright, diseases. Now you get chronic venous insufficiency, CVI, condition of poor venous return to the heart. DVTs. The most common cause is a deep vein thrombosis, incompetence of venous valves and muscles that aid in the venous return, signs of tissue congestion, edema, necrosis or skin atrophy, pain upon walking, venous stasis ulcers in advanced cases. Chronic venous insufficiency treatment depends on severity of the disease. Mild cases managed with controlled diet, exercise, use of compression stockings. Surgical repair of the veins includes repairing the valves, bypassing the incompetent veins, and or stripping. And venous thrombosis, a clot that can develop in the superficial or deep veins of the lower extremities, accompanied by an inflammatory response to the vessel wall that results from venous stasis, vessel wall injury, and increased blood coagulation. Risk factors include conditions that cause venous stasis, hypercoagulability, vascular trauma, older adults, and post-surgical patients, as immobilization results in decreased blood flow and venous pooling in the lower extremity. So this is very important for you to understand. So that's where you can get a DVT or a clot. Here's something that you want to make sure that you pay attention to. Venous thrombosis or DVT and pulmonary embolism. Implications for the PTA. When working with a patient with a DVT, deep vein thrombosis, or the PTA should monitor and report any signs of a pulmonary embolism, which would include swelling of the calf, which would be DVT, but then chest pain, hemoptysis, cough, diaphoresis, and dyspnea. When working with a patient receiving anticoagulants therapy for DVT or PE, should monitor and report any manifestations of excessive bleeding, blood in the urine, stool, along gums or teeth, subcutaneous bruising, back pain or flank pain. Report the observation of any symptoms immediately to your supervising PT and physician. Okay, so since they can't clot their blood, they run the risk of internal bleeding. Thrombosis, thrombotic agents facilitates clot dissolution. Most commonly used urokinase activase indications: acute myocardial infarction, pulmonary embolism, ischemic stroke, venous and arterial thrombosis. So if there's a clot, it'll help dissolve the clot. Implication for the PTA: need to be careful to not cause trauma due to altered clotting activity. So you don't want to be too aggressive because, or be careful with your touch as well. You don't want to have a heavy hand, someone taking anticoagulants, because you could bruise them and that could be a problem. So someone with thin skin, that's something that you want to pay attention to. How do you prevent prevention of DVT and pulmonary embolism? That's the key. We're going to do active and passive range of motions, early ambulations for brief but regular periods, coughing and deep breathing exercises, proper positioning, avoid one position for prolonged periods of time, avoid pillow under the legs. That's a no-no. A lot of people make that mistake. Minimal lower extremity elevation just above level of the heart. Avoid prolonged sitting and supportive garments such as compressive stockings. All right. That was good stuff.